my left, I could hear or see choppers coming. And they'd come in, and I could look up, and I'd see them fly over.
It may not look entirely real, but to Doug, it is the hellish Vietnam he experienced more than 30 years ago. It triggers the same pain, emotion, and anxiety.
You will relive it. Now, I'm in a little room, and there's air conditioning, and I'm sweating. Because when I was in Nam, it was 110 degrees. It was hot. And your mouth gets dry. Sometimes you feel the pain a little bit.
The sound of gunfire, M16s and AK-47s, is authentic. So are the sloshing noises Doug makes as he trudges through a marsh.
With the sound, it's not too cartoonish. Because you're taking yourself back.
Rice paddies, a landing strip, and open fields are part of the landscape. Doug is on a virtual battlefield, controlled not by the enemy, but by psychologist David Reedy.
A lot of times I come from the... Every session is uniquely tailored to the patient and where they are at that moment in time. I never do anything in virtual reality without the patient's permission first, and we talk about it beforehand. If the patient starts to become overwhelmed, then I back off the stimuli. I may lower the volume, I may turn off the effect, I may stop it.
I honestly think that if I hadn't done the virtual reality, I'd probably ended up in the hospital.
Virtual reality forced Doug to confront the feelings he had run from for decades, feelings that clouded relationships and darkened his view of the world. Post-traumatic stress disorder is an illness that can affect anyone who has survived an ordeal. Those who suffer with PTSD relive the experience in some way every day. Doug was seriously injured when the truck he was in was blown up 20 days after he arrived in Vietnam as a Green Army draftee. His leg was pinned in the wreckage and crushed.
I think some therapists are afraid of exposure therapy because they're afraid the patient will get too upset. But getting upset and dealing with the traumatic experience is sometimes part of the healing process. The key is to do it right.
You basically take yourself right back to that time and place that you were in now.
Reedy is convinced that virtual reality, in combination with group or one-on-one psychotherapy, really works.
We measure before treatment, immediately after treatment, at 3 months and at 6 months later. And in the immediately after treatment, at 3 months and 6 months later, in all three measurements, there are significant decreases in the symptoms of post-traumatic stress disorder.